The member for Fredericton Grand Lake and Leader of his party.
Thank you, Mr. Speaker. Mr. Speaker, government's been pushing for several weeks to have as many people as vaccinated as possible, which is a good thing. Even as we now have over 72% of the population vaccinated, we still all want numbers to go higher. However, government cannot, on one hand, push for everyone to get vaccinated and then, on the other hand, make it as cumbersome and difficult as possible for some to get the shot. For example, I spoke to an individual in Chipman who's trying to get her 3 grandkids booked for the vaccine but only has appointments available in Sussex, Oromocto and Fredericton, all of which those communities are an hour's drive away from the village of Chipman. Now think of trying to book 3 kids for vaccines on separate days, each one taking time out of school, parents taking time off work, then driving an hour each way to get their vaccine. Can the Minister of Health please tell me why people in rural areas are continuing to struggle to get the COVID vaccine locally, and why there's not more mobile units and vaccine clinics in those areas?
The Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, as of this morning, we are at 72.2% of all New Brunswickers 12 and over who are vaccinated. And over this last couple of days, I've certainly acknowledged that we want to understand any barriers that individual families or individuals themselves have at receiving the vaccination. We are also looking at every option possible. But please let me state that Moderna and Pfizer vaccines are not able to be moved to multiple locations. So we must have a plan in place, and that has been continuing on and to work with our communities. It's very important that we do have access to the vaccine, and so we will look at every opportunity to do that. And I just want to preface this by saying is that, you know, when we don't want to waste vaccine. So we will be deliberate in our attempts to come closer to communities that need them, and we're going to be working with public health to do that. Thank you, Mr. Speaker.